Hello and a very warm welcome to Rajya Sabha Television. You're watching the special telecast with me, Frank Rausan Pereira. On the COVID-19 vaccine front, there has been a lot of activity in the past few weeks with various companies sharing the initial analysis of their trial data. American pharma giants Pfizer and Moderna and Russia's RDIF have said that their vaccines have shown around 95% efficacy during trials. Serum Institute, the Indian manufacturing partner for Oxford vaccine, has also said that their vaccine is safe and effective, and several vaccines in India as well are in the human trial phase. To talk about the vaccines, how India is faring, and the best way forward as far as the entire COVID-19 situation is concerned, I have with me on the program today VK Paul, member NITI AAYOG. Dr. Paul, welcome to Rajya Sabha Television.
Nanda.
Dr. Paul, the focus right now, as far as the discussions are concerned, is concentrated on vaccines, vaccine development, and the vaccine candidates. Your thoughts on the vaccine candidates in India?
Well, India is very fortunate, India is very privileged, and India is very strong in the area of vaccine development. Indian industry has been responsible for providing more than 60% of children's vaccines to the developing world. We have a very, very strong base. We are also proud that we have a strong science and technology enterprise through our organizations such as the ICMR, the DBT, Department of Biotechnology, the CSIR, and DST, and so on. So we have the right ecosystem, both on the S&T front, but even more critically so on the industry side. And therefore, there have been fast development of multiple vaccine candidates within the country. If you go to see how many vaccine candidates are there potentially, including the ones which are in our laboratories in very early stages, which may or may not succeed, but they are there in terms of investigational candidates. We are probably having as many as almost 30 such candidates. But of course, the ones that have matured more in a more advanced manner are two candidates. One, which is the ICMR vaccine, inactivated virus, being developed by Bharat Biotech, and we have the DNA-based vaccine being developed by Zydus Cadila. In addition, there is a huge interest of the use of industry in the country by other countries and other laboratories and other companies who have their vaccines in other countries, but they want to bring it to India for implementation, but also for the development and manufacturing. And those candidates, as you know, include the AstraZeneca vaccine being developed in a large number by the Serum Institute, which is also conducting a phase 3 bridging trial. And also is the Sputnik 5 vaccine. And there are a couple others in the pipeline. So yes, a significant repertoire of vaccine candidates is right now in the process of development in our country.
Absolutely. As far as these vaccine candidates are concerned and looking at all the development, you mentioned it, in your opening remarks yourself, Dr. Paul, we have a history really as far as vaccine manufacturing is concerned. And, we are considered to be, a manufacturing hub for these vaccines. So how much of that past expertise is going to help in the production or manufacturing of these COVID-19 vaccines?
Well, it is the past experience that has paved the way for such a rapid and comprehensive response of vaccine creation and development in today's times. You know that the new vaccines take as many as 8 to 10 years to develop, or even longer. And here we have a disease which is less than 1 year old, or just about 1 year old. And the race to get a vaccine is in frenetic phase, in frenetic stage. And India's vaccine development portfolio is very much in line with the best that is being developed in the world. Definitely, the past experience has been handy. That means we have a technological base to be able to build on the existing platforms to deliver the vaccines, which require some, not necessarily exactly the same approach, but an adapted approach to get the right antigens converted into vaccines, workable vaccines.
Absolutely. So Dr. Paul, most of these vaccines that we presently have that we are administering very successfully, that we have been administering for several decades now, they are all not adult vaccines. So in COVID-19, we have to see adult inoculation. Is that going to be a challenge? Do you believe that it's going to be something that could pose at least challenges in the initial stages? Or is it going to be easier?
Well, a mix of both, but yes, to start with, yes, it is a challenge, but it is a challenge which is eminently surmountable. It is a challenge because it will be somewhat different approach. The target group is different. The target group is potentially large, and the settings in which the vaccines have to be administered will have to be therefore tailored according to the number and the profile of the beneficiaries. But something that can be managed, and in a way it is easy because you're dealing with adults who are sturdy. Giving vaccine is relatively easy for a vaccinator compared to a child, for example, who needs to be cared for in a more caring manner, more carefully, more delicately. So it's a mixed bag, but certainly having to vaccinate a large number of population, adult population, is an enormous task. And once we roll it out, this will be the biggest vaccine program on the planet ever. But yes, India has the wherewithal. We have a deep experience of universal immunization program, where 65 crore doses each year are administered, and so on. And also we have very massive and very systematic experience of smooth conduct of elections, where a finite number of people come to a booth. They are all organized in a certain way. There is no confusion. There is an enrollment. You go through a process. You happily go home. And it is close to people. People don't have to go too far. And we also have a technological strength to use IT backbone for the logistics management, for ensuring vaccine supply, the cold chain supply, engaging and enrolling the beneficiaries, giving them appointment to make sure that they come to a fixed place at a fixed time or a fixed time bandwidth, followed by issuance of a certificate that you got your first vaccine. Now this is another dose to be given after 4 weeks. Come for that, and then you have a full certification. So we have strengths which assure us that we will be able to conduct this vaccine campaign very effectively.
A couple of aspects that I want to take forward with you, Dr. Paul. Let me start with the first one. You spoke about, how we have a robust system in place as far as, the staff is concerned, the elections that we carry out, from time to time, and how we do a stellar job. But do you believe that, I mean, correct me if I'm wrong, but, I would believe that something like a vaccination drive would need a little more technical expertise. Do we have that? And how much of a factor is skilling?
Well, yes, vaccine delivery is technical in nature. Certainly it is. But it is not rocket science. Because if you have a safe, effective, well-stored, well-kept vaccine, what you need to do is to follow an SOP, standard operating procedure, to administer the vaccine intramuscularly to an adult. Vaccine delivery administration is a skill, of course, but this is a skill which is rather widespread amongst nurses, our ANMs, our doctors, not just MBBS doctors, but BDS doctors, also Ayush doctors. And if any further refinement of the skill needs to be given for a certain set of people, for example, nursing students, for example, even volunteers, it's possible to impart such skills in a short period of time in a safe way to deliver the vaccine in, again, a very, very safe way to other people. So it is something that is relatively manageable. And in any case, a huge capacity of trained people in the country exists.
Absolutely. So, another aspect that I wanted to raise with you, Dr. Paul, One, of course, is the technical know-how as far as the staff is concerned. Secondly, if you look at most of these vaccines, at least the results right now suggest that we need maybe multiple doses of the same
Mhm.
vaccine over a period of time. Maybe the first vaccine people would come forward voluntarily, and it might be a little easier to get them the first vaccine. But following up on that, getting a second dose or a third dose could be a challenge, don't you think?
It is true that the vaccine candidates that are visible today for possible early licensure uh, do entail more than one dose, typically two doses, about 4 weeks apart. But this is again something that we have been dealing with. In children, you give 3 doses of pentavalent, and so on. So this is not something inexperienced from our point of view. It's not something that is unknown. And yes, the pathways need to be created. That after you've taken the first dose, you'll please come for the second dose. And there should be ways, if for a genuine reason you can't come on that day, you'll come on a reasonably close day. That kind of a communication, that kind of mobilization is well known to the system. But yes, it brings in a complexity. If it was a single dose administration, the complexity is less. The logistics requirements are rather simpler. But then this should not deter us. We are used to this kind of campaigning, to kind of delivery and implementation. So it will be done. And the ways will be found. And of course, we will also prepare people that, look, you have to come for both the doses for optimum effect. And that, of course, we expect that people will be careful, and they'll engage themselves to make sure that they have the fuller protection that is possible through uh, 2 doses or the appropriate number of doses of any given vaccine.
There are a lot of talks in the West, a lot of murmurs doing the rounds that, the vaccine is being developed in less than a year. So probably, it's not going through all the tests. So there is a sense of resistance among certain communities and certain people to take the vaccine itself. So educating and awareness and creating awareness amongst the masses also is extremely important, isn't it?
This is very critical. And I think the clear message that the Honorable Prime Minister has given, that, look, there shall be no compromise with science. This nation will not compromise on science. And once the regulatory processes certify a vaccine to be ready to be administered to people, we must believe that the rigor of science, of safety and efficacy has been certified. And at that time, you have to make sure that there are no rumors, there is no disinformation, because we must have faith in our own systems. There is no greatest of the hurries for us to certify a vaccine tomorrow. No, we don't want to go through a process where potentially risky vaccine comes into play. Certainly not. And this point has been reinforced by the Prime Minister. And therefore, I would urge that once a certified vaccine is being made available in the country, please have faith that this has passed through the filters of scrutiny, filters of scientific rigor and robustness. And it is something then for the people to welcome and take for protection. I'll also like to say that it is equally important that the media, including the social media, does not play into such rumors. Have faith in the institutions of this nation, and we assure you that a vaccine that will be made available, or the next vaccine or the next vaccine, will be the ones where scientific rigor of the highest order has been ensured. And this is a vaccine for people. This is a vaccine eventually also for people of other countries. And therefore, there cannot be any compromise on the standards of a product that comes with the name of Made in India.
I,
Very
I think
important.
that's the key there, as far as we are concerned, because that's the kind of message that we need to take out to the general public as well, that our government and the authorities and people such as you are not going to put any lives at risk. So,
No question.
the $1 million question, Dr. Paul, is when can we expect a vaccine?
Well, I'll be frank on this, and I would say, look, a short answer is that yes, one can hope that in the first 3 months of next year, early next year, or using different words, can be a reasonable point where one or more vaccines could be available. But we must remember that hope and wish is one thing, but we will not compromise on scientific processes. Our regulatory system will look at the experience, the data, the efficacy, the safety, and only when those criteria are met would the vaccine will come into operations. But certainly, I think the way things are progressing, it is very likely that early next year there will be a vaccine, and then it is ready for scale up and implementation.
There are so many other things that need to come into place as well, Dr. Paul, when we're talking about, finally administering these vaccines. We have to ensure that the supply chains are in place. We also have to ensure that, we have a cold storage is in place. What's being done as far as infrastructure is concerned, and how are you taking that forward?
On multiple fronts. Let's take the need for cold chain. We are visualizing potential vaccines that are manageable through our conventional cold chain, for which there is a huge strength and as well as spare capacity already. This is the cold chain that we have been using for the universal immunization program. But certainly, as we move along and the vaccine availability increases very quickly, in a matter of few weeks, there'll be need for much larger complement of cold chain, and that is already being addressed. Already, the orders have been placed to ensure that we have enough cold chain in all the states, in all the districts, as per the requirements. The importance of an IT platform is huge in today's time. And we are looking at an IT platform built on the existing one, but to taken to a level which is aspirational and the very best in the world. We do also believe that such a platform that we would call co-win will also be offered to other countries as a product of India so that they can adapt it, that they don't have to reinvent. Now it has system to track the vaccines, track the sturdiness of the cold chain. It has mechanisms and enablement to organize vaccination sessions. It has the app that caters to giving appointment for the vaccine on a particular date and time at a particular geographic location. It sends SMS. It reminds about your appointment. It'll also deliver a certificate once one dose has been given, and then the second dose has been given, and so on. So IT platform coupled with logistics enhancement, including cold chain, and also preparing teams that will work on the ground, whether in the facilities, but very often outside the facilities, in booths, in schools, and panchayat ghar arrangements, where volunteers will be available for the smooth conduct of the vaccination session, which will be a day-long activity. Vaccinators and support teams, but also an orderly conduct of the vaccine. This is the way it's being visualized systematically. People's participation will be very important. Right information to be communicated to them at the right time about the vaccine sessions or the safety of the vaccine and so on will be very critical. Engagement of Panchayati Raj institutions will be critical. Involving NCC, NSS cadets and other volunteers will be very important. So this will be a campaign, this will be a mission, this will be an andolan in a gentle, safe, systematic, and a sustained mission that we hope to undertake in coming months.
All hands on deck is what you're suggesting, and that's the best way really to deal with this and to ensure that everybody comes together as one. Talking about coming together as one, I know that you recently had a meeting with the private sector as well. What came out of that, Dr. Paul, and how is what role do you see the private sector playing, and what is it that they have committed?
Private sector has several complementary strengths. They have individuals who can give injections, vaccinators, particularly in urban areas. They can complement organizing the vaccine camps or booths. They can be located in private facilities. They can join hands with the public sector teams to conduct outreach activities. In addition, if need be, cold chain complementarity can come from the private sector. But above all, managing the huge logistics as required, the private sector would indeed be a great help. And we are making connect with them. We are together in this, and the strength of the private sector, both in the health sector itself and beyond the health sector, would come handy. We are also looking at civil society being involved, just as they have contributed to great successes in polio campaign, for example. We are hoping that such mechanisms and such offers and such participation would emerge very soon.
And my final two questions to you, Dr. Paul, before I let you go. As far as the current situation is concerned, we saw that the cases had dropped considerably, but then we saw a third wave, cropping up in several of the states. Delhi also witnessed a third wave. What can be attributed to that, and what are we doing about it?
Firstly, remember that this is a new virus. This is a virus which is very intelligent virus. This is an organism that surprises people, surprises nations. And therefore, so long as we are susceptible to the virus, we have to be very careful. And that is the notion that comes through once again when you find that in many cities things were fine, many states things were fine, and then you lose grip. It happened to Kerala, for example, done so well in the early stages of pandemic, the role model control. And then somewhere down the line, adverse things happened. In Delhi, we have seen so-called three spikes. June, July, massive effort, it subsided, deaths came down to below 10 almost, and then there is an upsurge. Certainly, there are factors that we know could be responsible. One such factor is weather. Cold weather means we are huddled together, and the respiratory viruses find predilection to enter your body a little more energetically, and so on. Pollution, yes, pollution technically plays a role, scientifically proven is a reason. But I think also crowding and mixing and lack of social distancing in the festival season. So at least these three factors we believe could have contributed, because science tells us that these matter. There could also be some unknown factors that we are still grappling with, and I think we should keep that in mind. And therefore, the general principles of averting the pandemic, making the pandemic to spread in a more and more difficult manner. In other words, ensuring that the chains of transmission are broken, are suppressed all the time, to the extent possible. Those measures must never be compromised. This is not the time to compromise on them. And what are those? Well, those come from two angles. Firstly, it is about a cliche, but it is about COVID appropriate behavior. There are three buckets in that. One is the three mantras that the Prime Minister has given: mask, 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 physical distancing, and washing hands, keeping hand hygiene appropriately. The second component is equally important. Do not become part of a crowd. Don't crowd. Don't go out if you can please avoid. Second part of this is protect the elderly. Please be careful that they are not to come out, but also when you are even within the home, protect them by wearing masks and so on. And also, remember, we believe that Ayurveda, immunity booster agents and simple preparations that we have traditionally are useful. So I'll put this as a second box. And my third box is equally important. And I think you all should make efforts to educate people on that. Firstly, if you have symptom, please do not delay your testing and to be seen by a physician. If you delay, it's bad for you, and it is also bad for the society and your family, because God forbid, if you have the virus, you are spreading the virus. Second part is that if you have been in touch with a person who you now know is positive, then you are a contact. And the responsibility of a contact is to be away from others through a process called quarantine. You are isolating yourself. You are duty bound to do this. Remember, you are duty bound to do this so that you are concerned that you protect yourself, you're careful, and you're watching your symptoms. But more importantly, you are making sure that you do not spread, potentially, if you have it, do not spread infection to other people. You should not be part of the chain of transmission. The chain should stop with you. So that is the responsibility of a contact. The first one is the responsibility of the person who has symptoms, who should test himself or herself and himself, as well as for others. And the last one is the ninth point in these three buckets of three each, is that you must be on board with your Arogya Setu app and keep your Bluetooth on, because it helps you and it helps others to be protected, and it helps the government in making sure that the pandemic control mechanisms can be invoked, because we will get the right signal. So this is very, very important. And the second part of this is what the system should do. System should help you get isolated. System should make sure that if you're positive, you are either looked after at home in a supervised way or you are in a facility. It is the duty of the pandemic control authorities that we maintain containment zones if required, so that the disease can be contained. This transmission chain remains localized. And we also conduct, as required, zero surveys, as required investigation of clusters, as required strategic screening of people who could be super spreaders in super spreading situations, such as the markets and such as common places and bus stands, and so on and so forth. So this is a bipartisan responsibility of what you do to ensure that the transmission does not happen. And then it is for the system to ensure a pandemic control effort to make sure that if it starts, it can be stemmed in a systematic way through scientific tools that are available to us.
My final question was going to be, Dr. Paul, on what would your message be to the people of this country? But you put things so well in perspective for us, and you summed it all so very well that I don't have to ask you that, and we can leave it on this note when you sent out such a great message to the people of this country, knowing, all of us knowing that, we are in good hands as far as our healthcare is concerned. Dr. Paul, thank you so much for joining me on the program and sharing your views on this subject. And on behalf of the entire nation, I would like to thank you and members of the medical fraternity and all frontline workers for doing a stellar job. Your sleepless nights are ensuring that we sleep well at night. Thank you so much.
Thank you very much. Thank you.
All right, then with that, it's a wrap on this telecast. See you again.